I learned about a case up in Nashville where a gentleman who had been an alcoholic, he was estranged from his one remaining family member, a daughter, for about 10 years before he ended up in the intensive care unit with a bleed into his brain, on a ventilator, and was not getting any better. Well, they managed to track down his daughter, who was in a neighboring town, and called her up and said, hey, look, we got your dad in the intensive care unit. We need some help with medical decision making. Now, this gentleman didn't have a living will, and he had not assigned a healthcare surrogate. So what they were doing was calling her as the proxy. So in every state, the laws, just like if you don't have a will, the state will decide what happens to your estate. That's what they call probate, or it's at least one of the functions of probate. If you don't have a living will and you have not assigned a surrogate, then the state decides who it is that I should be talking to about your health care. It's usually sensible, but it may not be the person that you would think would best represent your wishes. So it's talking to your spouse if they're alive and capable of doing that. And then your adult children, either in order of age or a preponderance of opinion of your adult children. And then it might go to your siblings if you've got siblings that are alive. Somewhere down the list is your parents if they're still alive. So the state dictates who the proxy is. So the doctors called this woman up and said, we need you to come help out with your dad's decision making. She said, well, I haven't talked to my dad in 10 years. I've not talked to him at all in 10 years. For the 10 years before that, we didn't have any meaningful conversations because he was drunk all the time. They said, well, sorry to hear that, but we still need your help because we don't know the man. So she did come to the hospital. They explained to her what her job was as his proxy, and she thought about it for a minute. She went to his apartment, talked to his landlord, got his picture, found out where he hung out, which bar he hung out at, went to the bar, found his friends at the bar, and set him down while they were still reasonably sober, bought him a drink, and said, here's Dad's situation. He's in the hospital. He's had a bleed into his brain. He's on a ventilator. They're not expecting him to get any better. What would he want done under these circumstances? And they unanimously agreed that he would not want that perpetuated. He didn't have such a great quality of life in the first place. So she was able to go back to the hospital and represent what her father's values were, even though she did not know them personally. What she did was the job of a healthcare surrogate or proxy, which is to represent the wishes of the person you're representing, to represent their values, to speak in their place, which means it's not about saying what you think ought to be done. So she didn't arrive and say, well, here's what I think we ought to do.